show you around a little bit. I want you to become familiar with the office and how the process works. If you take a look around, and if you've been to a chiropractic office before or even other doctors' offices, you're probably going to notice this looks quite a bit different, and it's set up that way for a purpose, for a reason. We're not like most other chiropractic offices. We do something called corrective care, and corrective care is we want to change the angles of the spine, so we have to be very specific with the x-rays, with the measurements, and the way we adjust. So come on, let's take a little look around here. And after you sign in, you actually have a sign-in station at the front desk here. You swipe a card, you come on in, and then you're going to come over here to what's called the cervical traction on the wall here. We have 3 stations, and you basically put this around here like this, and you're going to do this type of motion right there, and that puts more curve in the spine here, more curve here, more curve here, and it decompresses the whole spine at the same time. So that's the very first thing that we have you do once you're established as a patient here. So we want to get that spine loosened up. The second thing, we're going to have you come and sit on these wobble seats right here, and with that you're going to have basically 3 ranges of motion. You're going to have the forward and back range of motion, you're going to have the left and right, and you're going to have rotation like this right here, because there again we want to get the spine warmed up and loosened up before the adjustment. It's very important that it's warmed up, because that will help me move it better and get more movement in the spine and get it lined up the way it should be. So if you haven't figured it out already, the 2 main things I do is get the spine moving again and get it lined back up again. That's my main 2 jobs that I have to do here for you. So let's come on in here, look at another room. So with most or a lot of the patients, after they do those exercises, we'll have them go on one of the traction tables here. We actually have 2 different traction tables, and these have actually been set up also for specialized purposes as well. This one here, if you lay on this end, it's a traction table that goes up and down to help just move your spine. If you lay on this end with your neck over this and your face up, this actually wiggles back and forth to help break up scar tissue and adhesion in the spine, to help put that curve back in there that everyone is losing nowadays with doing this all the time. If you come over here and look at this one, on this end, your head here, this is also a traction table to move the spine. But if we switch you over here, your head goes over this, your back goes right here, and this thing jumps up and down like this right here to get rid of the rounded back like this, to help break up that scar tissue and adhesion and get you standing back up taller and get rid of that humpback that so many people have. So these are really cool tables. They do great work for us here. So let's go on to the next room over here. Over in here is our X-ray / F&D table room, and here's the X-ray equipment. It's actually a digital system. It takes very sensitive X-rays. I can see a lot of I can actually see a lot of soft tissue as well. So I can see like if the disc is not doing too well in there. And then right here we have something called an F&D table. It goes up and down like this right here with you laying face down. A lot of people like to call it the dolphin table. But what this does, this goes up and down, and we stretch your low back out where it gets so compressed down here, bulging those discs, causing pain, causing compression and degeneration there. Okay, let's go on in here to another room. So these are 2 adjustment stall areas for the main adjustment. They're both identical. So we'll have 2 people, 1 on each side when they come in and get set. And these are very specific type of tables. They're called Omni drops, and they have 5 drop stations in them, so I can be very precise at where I'm trying to get the movement in the spine to get it to line up properly. One of the other videos I did a demonstration with this. Stim tool works really great for moving the spine, moving the bones, being very specific about where we put it, where we put the bone. And like I said, we have so many people that come in that or won't even come in for chiropractic because they're afraid of snap. And like I said, I don't do that on everyone. Some people want it. Some people could need it more than others. But not everyone gets that, and you definitely won't get that your first few visits. And if you don't want it, you'll never get it. And what the problem is with that is if you've lost the curve of your neck and it's straight, you don't need that rotation adjustment because it jams all the facets into each other, actually causing some more problems. So it's not necessarily a good thing. This is your computer sign-in. When you come in, you swipe a card here. It brings up all your X-rays, all your information. So when I'm sitting there or standing there adjusting you, I look over and I'm looking at exactly what's going on with you each time. So that way I don't miss anything. I get very specific and I know exactly what's going on with you to do the right thing.